Now, imagine going to the toilet and noticing blood stains in your stool. Your mind may start racing around some hundreds and thousands of stuff because you don't just know where this one is coming from. I personally know someone who literally passed out because of something like this, and you don't blame them. To be frank, things like this can be very disturbing, especially if it's happening for the first time, or there are other accompanying symptoms that you're not comfortable with. Fair enough, it usually attracts immediate attention, although most of them end up on assumptions and self-medications. So, having been in practice for a while now as a medical laboratory scientist, I can tell how terrifying some people can be at the sight of blood. And this usually happens during blood sampling. Even with all the procedural preparations with them, they are still scared. And so I get it. This fear that pops up when you see blood, especially in yours too. But do you know that having a good knowledge of the causes can actually help you in most cases? And by this, I don't mean it's going to take away the seriousness of this, but it can help reduce the fears, the panics, the assumptions, and anxiety that comes with all of this. And more importantly, this can help you to access the right medical assistance when things like this are going on. And so in today's video, we're going to be looking at the common causes of this and what you should do if you notice any of these. Ensure you stay with us to the end because this is going to be a very interesting conversation. Ensure you subscribe to our channel so that you can be getting amazing videos like this. Alright, let's get straight to it. The first one on the common causes of blood stains in your stool is what is known as hemorrhoids. Now, these are caused by swollen blood vessels around your rectum or your anus. Do you know that this is what many people call pie? Yeah, it can be internal or external depending on the location now. So people are majorly used to external pie because this one pops out when you are pooing. And so usually you notice these bright red blood stains either on the tissue paper or on the waste itself, accompanied by some pain that can be either moderate or severe in any case. Secondly, there's what is called anal fissures. These ones are tears around your anus that are caused by either passing hard or large waste and also constipation. There are other causes, things like strains during childbirth for some ladies and anal intercourse. Oh, you don't know? There is this sharp pain that comes for people who have this that will make this whole thing very excruciating and then accompanied by some traces of blood that will pop out. So for people like this, the thought of going to the toilet again would just be a nightmare for them because the pain, the trauma of seeing blood, and all those things make it very, very uncomfortable for them. Do you remember that we said bleeding can happen from peptic ulcer? Yes, it can happen like that because the sores can bleed when the blood vessels around them ruptures. And so when this happens, you see that your stool will be very dark or black in color. Why is this happening like that? Because the enzymes must have digested these blood cells, making them very dark before you pass them out. And what causes them? H. pylori. Secondly, excessive intake of alcohol. And again, some painkillers. When you misuse them, they can cause this kind of ulcers that bleed. Other GIT infections can also cause this bleeding and blood stains in your stool. For instance, we are saying that apart from H. pylori bacteria, other bacteria, fungi, viruses, and parasites can actually infect and inflame the linings of your GIT. And when this thing happens, you're going to bleed. So this one comes with things like abdominal pain, fever, diarrhea. You will notice blood in your stool. Now, there's this guy called inflammatory bowel disease. So this is like an umbrella term given to some conditions which are capable of inflaming your GIT. There is Crohn's disease, there is ulcerative colitis. And Crohn's disease is more common within the small intestine, whereas the other one, ulcerative colitis, is majorly found within the rectum and the large intestine. These two present with diarrhea, abdominal pain, and also bleeding that can present in your stools, making them visible and causing you fear. Last but not the least, there is colorectal cancer. Now, this is a type of malignancy that develops from some precancerous growth known as polyps. Polyps are usually found within the large intestine or the rectum. And so these ones present majorly with intestinal obstructions, and abdominal pain. But do you know that the color of your stool can help you to guess where this might be taking place? For instance, if you notice bright red blood stains in your stool, it really means the bleeding is happening at the lower part of your digestive tract, places like the rectum, the lower part of the large intestine, and the anus itself. And why are they so bright? Because they haven't been digested by some gastric enzymes, and so they are so fresh. On the other hand, if you notice that your stool is very dark, it means this bleeding is happening at the upper side of the GIT, where the gastric enzyme must have digested the blood from the bleeding sites. Places like the esophagus, the stomach, the small intestine, these are commonly the location which you can find that. More interestingly, there are other cases where you don't even notice any blood stains at all. What is happening? Because in this case, the bleeding is not much enough for you to detect a visible one in your stool. And so the only way you can find out is to carry out a test called fecal occult blood test. So this is what you should do. If you notice any blood stain in your stool, observe it very well. Note the appearance of the stool, the amount of blood stains in it, and also note the frequency with which this happens. Check out for other signs like abdominal pain, diarrhea, fever, and dizziness, and more importantly, contact your doctor as soon as possible because blood stains in stool is not something you should joke with. And remember, the earlier you do this, the better chances of avoiding complications. If you found this video very interesting, do well to like, share for others to get to hear about this. Subscribe to our channel so that you can be getting amazing ones like this, so that you don't miss any video at all. Thank you so much. See you in the next.